Hi, my name is Alec Alarakhia. My mentor was Maggie Chivilicek, and I completed research on exploring sleep's impact on the mental health, academic and work performance, and physical well-being in medical students and healthcare professionals. So just a little bit of background on me. I am a senior at Berkeley Preparatory School, and I'm very passionate about research. Over the summer, I participated in the UF SSTP program, which is the Student Science Training Program, and I did research on testing wild-type firefly luciferase to enhance bioluminescence using machine learning. But I was interested in conducting some more independent research of my own. Um, Although I have no access to a lab, I was hoping to um, create a literature review on a topic of my choice, which is why I wanted to do a project through Polygence. So my research focused on how critical sleep is and the deficiency of sleep in the medical field in both medical students and healthcare professionals. I wanted to explore the multifaceted consequences of high sleep deprivation rates, of demanding work weeks, of overall the lower sleep on average in medical students and healthcare professionals. And I wanted to focus on some specific factors, including mental health, academic performance, work performance, and physical health. And as I mentioned before, it was a literature review to analyze the existing research that is already present in this topic. So the focuses of my paper were on investigating sleep's impact on mental health by testing depression, anxiety, stress, burnout, quality of life, and more. I then wanted to test sleep's impact on academic and work performance through indicators such as GPA, overall cognitive abilities, the presence of medical errors, and diagnostic accuracy. And then finally, I wanted to test sleep's impact on physical health and relationships by testing physical fitness, cardiovascular factors, and various other health factors, and overall familial and romantic relationships. So first, let's talk about mental health. In medical trainees, there was, with poor sleep quality and overall reduced levels of sleep, there were higher rates of depression and anxiety and lower reported quality of life overall. Additionally, there were higher psychological stress levels. As for healthcare professionals, similar findings took place with reduced sleep or poor sleep quality. There were increased rates of depression, burnout, and anxiety, as well as sleep disorders and disruptions and nightmares. And one thing that is interesting about healthcare professionals is that these markers were even more elevated during the COVID-19 pandemic with poor sleep, likely due to the fact that there was added stress during this time in such a pressing health crisis. Next, academic and work performance. In medical trainees, it was found that with worse sleep, there were lower average GPAs, and with lower average GPAs, these students also were found to have worse sleep quality and lower sleep duration. Their motivation for learning was affected by sleep loss, and cognitive abilities overall were reduced among resident physicians and medical students. As for healthcare professionals, their critical skills were impaired, and more medical errors were present in healthcare professionals that had either reduced sleep or poor sleep quality. The diagnostic accuracy overall was reduced, and the healthcare professionals were found to be less patient and attentive. This obviously has very negative implications on these healthcare professionals and their ability to perform in their respective jobs. Interestingly, it was found that reducing work hours helped to improve the attention deficits of these medical professionals who were sleep deprived. As for the physical health and relationships of medical trainees, it was found that with they reported less physical activity and less leisure time when in the medical trainees who had worse sleep quality or lower sleep duration. Additionally, there was found to be worse physical health with greater sleep deprivation, and personal relationships and daily tasks were negatively impacted. Similarly, in healthcare professionals, there were a lot of these similar findings took place, including worse physical health overall. One interesting thing is that with healthcare professionals, night shifts are more common, and this led to circadian misalignment. This circadian misalignment led to an increased risk for accidents, type 2 diabetes, weight gain, cardiovascular diseases, strokes, cancer, and more. So the overall risks of these night shifts were tremendous and had many negative effects on these healthcare professionals. Additionally, similar to medical trainees, relationships, both romantic and familial, were adversely affected as a result of poor sleep quality or lower sleep duration. So as for the implications of my research, overall, this can help to reduce medical errors, especially in healthcare professionals that have been reported to have lower attention deficits and have been reported to have greater medical errors as a result of poor sleep. Also, this research can be used to improve the overall quality of patient interactions by making the healthcare professionals more attentive. It can be used to improve mental health of both medical students and healthcare professionals due to the correlation that has been found between poor sleep quality and decreased mental health. Overall, it can improve clinical competence in healthcare professionals and improve the quality of life of both medical students and healthcare professionals. And just generally, it can improve the long-term physical and mental health of both medical students and healthcare professionals as presented in the prior results. As for how we can look forward to making changes, most importantly, in my opinion, I believe we must seek systemic changes to improving the overall sleep quality and sleep duration of medical students and healthcare professionals. The results have shown that sleep is paramount to for medical students and healthcare professionals to perform both in the classroom and in the hospital. So systemic changes must be pursued. One systemic change that can be made is through work environment policies. By reducing work hours, which I mentioned earlier, can definitely benefit the physical health, and for shift schedules, we can, with work environment policies, by changing shift schedules to include less night shifts, it will reduce overall circadian misalignment in healthcare professionals, which will improve the overall quality of care of healthcare professionals. Additionally, there should be rest periods implemented within the work hours of medical students and specifically healthcare professionals so that they can provide better treatment. And overall, hospitals and educational institutions alike should promote better sleep hygiene. In educational programs, there should be sleep education into medical training and the overall importance of sleep in medical performance. There should definitely be some educational programs directed towards this. And medical trainees and professionals should be instructed on the importance of sleep in their quality of performance. So some conclusions. The mental health was worsened in medical students and healthcare professionals as a result of poor sleep. Academic and work performance were adversely affected by poor sleep in medical students and healthcare professionals. And finally, there were reported worse physical health and overall relationships, both familial and romantic, in medical students and healthcare professionals. Some limitations of the research is that there are multiple related factors. So, for example, stress may be caused by many other factors besides just sleep. It may not just be sleep that impacts the overall stress of a medical student or healthcare professional. So it can be very difficult to pinpoint the specific reasons as to why stress is adversely affected. So more research must be done in the future to determine this. And then also there is a bit of circularity of argument in my research. Is it poor sleep that causes stress, or is it stress that causes poor sleep? Similarly, more research must be done in the future to determine this. I would like to acknowledge my mentor, Miss Maggie, for all of the help that she provided me through this process. I would like to acknowledge the Polygence program, of course, for providing me this opportunity to conduct this research and to attend this symposium. And finally, I would like to thank Dr. Wendy Carino, one of the editors of my research paper, who provided many insightful edits to my paper. These are my references.
Wonderful.
Thank you very much.
Wonderful. Thank you, Alec. That was a phenomenal presentation. We do have time for one question. And the question is, now that you've completed this, what are your next steps? Would you like to explore a related topic or continue to expand on this research?
Absolutely, that's a great question. So I am a high school senior, and I would definitely like to expand upon the overall research that I included in this paper. I think that I focused on many important factors, but I definitely think that there are other factors that are impacted by sleep that could definitely that I would definitely like to address in the future. Additionally, I would like to hopefully in university conduct some research of my own on sleep, because I have heard from medical students and healthcare professionals that I know the importance of sleep and how so many individuals lack the necessary sleep to be able to perform either in school or in the hospital. So I think that this is very important research, and I hope to contribute to it in the future, either by adding different factors to my research or by conducting independent research of my own.
Thank you, Alec. A great presentation.
Thank you.